So I focus on the field of breast cancers. So why is this important? So firstly, breast cancer is the most common cancer amongst women, not only in Malaysia but worldwide, with new ways to understand the cancer better, as well as new treatments for the breast cancer. We are now able to personalize the treatment for most breast cancers. We know that there is not just one breast cancer, there are many different types of breast cancers, and the way we treat them is different. Either different types of treatments like targeted treatments, immunotherapy. So they are specifically for certain types of breast cancers. So we need to be very personalized with our treatments for breast cancer patients. Not only that, we also need to make sure that we arrange the treatments correctly, we sequence the treatments correctly, especially for aggressive types of breast cancers in the early stage. We need to give the chemotherapy, the targeted therapies or immunotherapies upfront before the surgery. Then only the surgery happens. This way we will know whether the treatment is working. If there are no more cancer cells in the breast and lymph nodes, we know this patient is going to do very well. It's usually a multidisciplinary approach to treating breast cancers. So we need a breast surgeon, we need a breast radiologist to interpret the scans, the mammograms, the MRIs of the breast, and we also need an oncologist who is able to deliver the right treatments as well as radiotherapists to give radiation when it is needed.
Very honestly, if you were a woman who found a lump in the breast, there's only one thing you want to know, whether it's a cancer or not. And in this center, the setup is such that we can give you the answer within 48 hours. And I think this is the first and probably the only breast cancer center, maybe in the whole world, that can give you that answer in 48 hours. But this was the first private one-stop breast care center that we set up, and we set it up in about 2006. So we have everything in one place. As you walk into the clinic just now, you can see there's a waiting area. You're registered, and then you see the consultant. And then if you step out the door, there are mammogram machines there. So you have your mammogram, and you walk down the corridor, the radiology department is there, the imaging. It's a very, very comforting thing to know that when you come in here, you don't spend days or weeks wondering whether is it a cancer, is it not? You don't lose sleep over the next, sometimes it's even up to 6 weeks before you get an answer.
Okay, so our breast cancer center is quite a complete. We have a complete range of comprehensive range of technologies and services available. Intraoperative radiotherapy is a radiation therapy. It is the latest revolutionary radiotherapy system that we use for early stage breast cancer. All right, it has been around for the last 10 years, and we have been using it for the last 3 to 4 years. Intraoperative radiotherapy, as the name states, is actually a radiation therapy that is given at the time of surgery. So these are for selective cases whereby there's a certain selective criteria that we used, that we have to establish before we can offer the patients these services. And for some of them, they has to be like older patients, smaller tumor, and early stage kind of tumor. So that means when the tumor is still small, during the surgery, we'll remove the lump, which is called lumpectomy. And then after that, at the same time, during the surgery, we will put in the radiation probe and give the radiation therapy at the same time. All right. So the benefit of this is that we just give a single dose, a single therapy dose over the conventional method of external beam radiotherapy, where it's given over about 3 to 5 weeks. So it is a convenience that can be offered to the patient, but only in some selected cases.